2025, the World Health Organization adopted a new global treaty to help countries with the next pandemic.
No objection. The resolution is adopted.
Countries are still negotiating an important part of the agreement, its annex on the Pathogen Access and Benefit Sharing System, or the PABS system. The main text of the pandemic agreement is quite weak. It doesn't guarantee access to vaccines, treatments, and diagnostics. That's why many developing countries say that the PABS system is the heart of the whole agreement. It's the part that could make the treaty meaningful in practice. This part could create enforceable commitments on how countries share samples of pathogens with pandemic potential and their genetic data, known as sequence information, and just as importantly, it would also create enforceable commitments on how the recipients of the samples and sequence information share benefits arising from the sharing or utilization of these samples.
Versus $6.69 that analysts were looking for. In terms of the COVID business, of course, this is massive. The COVID vaccine community, they see $32 billion in 2022 sales. That's up $3 billion from what they projected last quarter, and that's based on contracts signed.
There are well-established global rules on access and benefit sharing under the Convention on Biological Diversity and its Nagoya Protocol on Access and Benefit Sharing. These international treaties say that countries own their biological resources, and to access these resources, the recipient should agree to fair conditions, including benefit sharing through contracts. Article 12.6 of the Pandemic Agreement already says that during a pandemic, manufacturers that use the PABS system will provide access to a target of 20% of real-time production of vaccines, therapeutics, and diagnostics for the pathogen causing the pandemic, of which 10% is to be provided to WHO for free, and the remaining percentage provided at affordable prices based on capacity of the manufacturer. The aim is to ensure that during a pandemic, affected developing countries, and especially the poorer countries, are not pushed to the back of the line as happened during COVID. As part of benefit sharing, developing countries have sought guarantees for proper prevention, so that a percentage of medical products be reserved for WHO to help countries prevent and respond to a public health emergency of international concern, a level of health threat that occurs before a pandemic is declared, so it doesn't reach pandemic levels. They have also proposed that production licenses be provided to developing country manufacturers to expand supply during surges in demand, and that entities generating revenue make regular monetary contributions to the PABS system. All of this can only be guaranteed through enforceable mechanisms. So, for an effective system, it is absolutely crucial that any entity seeking access to PABS material or sequence information be identified, verified, and required to agree to the terms and conditions of the PABS system through an enforceable contract with WHO. These contracts should be standardized, and no onward transfer of PABS material and sequence information should be allowed, except if the recipient also agrees to the PABS terms. Databases wanting to host sequence information shared through the PABS system should also require their users to register and accept a data access agreement that would elaborate on the conditions of use and benefit sharing as required by the PABS system. More than 80 developing countries have proposed these elements, but a powerful bloc led by the European Union and supported by countries like Germany, Norway, Switzerland, Japan, Australia, and Canada is resisting. They oppose mandatory contracts for all recipients. They oppose user registration and data access agreement for those accessing PABS sequence information. They are also against meaningful benefit sharing obligations. Under the false narrative of open science, they support a model that will allow recipients to lock up the research and development results through patents and other intellectual property rights. In effect, they want shared public health resources to be turned into private monopolies. In short, the European Union and its allies favor a model that enables extraction of resources from the global south for the commercial benefit of its companies and institutions. Such an approach risks embedding structural inequities directly into the pandemic agreement itself. This is why the debate matters. At the core of the negotiations, it is a question of whether the PABS system will be designed around equity and public health or around commercial interests and profit of a few developed countries.
In an act of what's come to be known as biopiracy.
C'est l'appropriation et la commercialisation illégitime de ressources biologiques par le biais de brevets, par des firmes privées du génie génétique, et tout cela sans consultation ni contrepartie, ce qui nous ramène finalement vers des temps, j'ose le dire, vers des temps coloniaux.
It is time for civil society, pro-public health scientists, health professionals, and others to call this out. And countries of the Global South must remain united and firm in demanding a PABS system that genuinely advances fairness, accountability, and public health, not one that entrenches existing inequalities.